Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about light microscopy, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, evidence ideas, and some helpful tips to make candidates' portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the first subsection of the fifth section, microscopy and image capture, called light microscopy. The knowledge requirement explains what knowledge is expected of the candidate in relation to the relevant subsection. Candidates should be able to demonstrate their knowledge at the specialist level. Think about what knowledge they had as a Band 5 BMS. How would that differ to the knowledge of a Band 6 BMS? That specialist level of knowledge would allow the candidate to troubleshoot, problem solve, verify or validate. The first knowledge requirement is principles and application of light microscopy in clinical diagnostic procedures. Candidate needs to have the knowledge and understanding about light microscopy. You could ask the candidate to explain what light microscopy is and how it works, to explain how microscopic image is formed, to name the applications of light microscopy in clinical setting, to explain how light microscopy is used in histopathology. When addressing this knowledge requirement, candidates should consider illumination, magnification, image formation, working parts of microscope like light source, condenser, diaphragm, objective, eyepiece, or stage, special techniques like bright field, dark field, phase contrast, differential interference contrast, fluorescence, confocal, or polarized, applications for routine diagnosis, IHC, and special stains review, screening, intraoperative assessment of F/S, digital pathology. Education. The second knowledge requirement is microscopic recognition of normal histological tissue and some key features of pathological tissues. Candidate needs to have the knowledge and understanding about recognizing histological tissue. You could ask the candidate to microscopically recognize histological tissues from images you provide, to list the key features of major organs they use for identification of tissue, to list the key microscopic features of pathological tissues. Competence requirement is basically a combination of knowledge, skills, and experience candidate needs to perform a job to a satisfactory standard. Candidates' chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this subsection. The first competence requirement is set up a light microscope for color illumination. Candidates should be able to perform color illumination. Does the candidate perform color illumination setup correctly? Do they set up the light microscope correctly? Do they take the appropriate steps during the microscope setup? When addressing this competence requirement, candidate could consider the key steps like focus, magnification, field diaphragm, centering, their training and competence, reasons why setting up microscope is important. The second competence requirement is identify normal tissue, cellular appearances under the microscope and be able to recognize commonly occurring pathological features. Candidates should be able to identify healthy and pathological tissues microscopically. Can the candidate correctly identify histological tissue microscopically? Can they identify the key features for tissue identification? Can they recognize pathological features seen microscopically? When addressing this competence requirement, candidate could consider tissue-specific features like epithelial versus connective versus muscle versus nervous, organ-specific features like kidney and presence of gloms, liver and presence of lobules, portal triad and central vein, thyroid and presence of colloid, lung and presence of alveoli, breast and presence of ducts and lobules and so on. As for pathological features, they could consider cellular changes like size and shape, nucleus to cytoplasm ratio, mitosis, tissue architecture, presence of fibrosis, inflammation, necrosis, neoplasia, scarring, metaplasia, abnormal cellularity, structural composition or increased proliferation. The third competence requirement is recognize special stains on normal tissue types, controls. Candidates should be able to recognize special stains. Can the candidate recognize types of special stains used to stain histological tissue? Can they identify the tissue type? Do they operate microscope correctly to recognize special stains? When addressing this competence requirement, candidate could consider correct microscope setup and use, demonstration methods for carbohydrates, lipids, pigments, minerals, infectious agents, and extracellular proteins, microscopic examination of stained slides, demonstration method used and the target element pictures they highlight, their training and competence. The fourth competence requirement is recognize common staining patterns of normal tissues using immunocytochemistry. Candidates should be able to recognize common staining patterns on IHC slides. Does the candidate correctly recognize staining patterns on IHC stained slides? Can they recognize the tissue type? When addressed competence requirement, candidate could consider correct microscope setup and use, demonstration method used and the target element they highlight, their training and competence, primary expression patterns like nuclear, cytoplasmic or membranous, tissue type pattern like epithelial, connective, neural or lymphoid tissues. Each section also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each section. When they complete all the subsections within each section, they will be required to write a reflective statement. They also need to write a personal reflection on their training and why they chose their evidence. To prepare for that, ask them to write a smaller reflective statement for each subsection. What is their role and context of this subsection within the lab? What does their evidence demonstrate? Ask them to write a smaller justification as to why they chose their evidence for this subsection. Also ask them to write about what was their training like when to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier for them at the end of the section. Each subsection also has evidence of achievement. This is a part where you, the training officer, sign the candidate off as competent and fit to practice as a BMS at the specialist level. By doing that, you will confirm that the candidate can work in accordance with local SOPs relevant to this subsection. This will also confirm that candidate has answered questions set by you to test their knowledge and skills relevant to this subsection. And you will also confirm that candidate's chosen evidence demonstrates their competence, relevant to this subsection. The candidate will need to be signed off as competent by an internal assessor for each subsection. They can be signed off by you, the training officer, senior BMS overseeing relevant section, or by the training lead. These are some example questions you could give your candidate to test their knowledge and skills about this subsection. These should be based around the knowledge and skill requirements mentioned earlier. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. You could ask the candidate to complete tables you created, based on knowledge requirements. You could ask them to identify tissues from micrographic images. Supporting evidence should be selected by the candidate. It needs to be based around the competency requirements, and be relevant for each subsection. The evidence should allow the candidate to demonstrate their competence in each subsection. It should be specific and relevant to the candidate's in-house practice. It should also demonstrate candidate's specialist competence. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Link will be included in the video description. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs or even videos, if they can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be you, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like case studies, for each subsection. They could use experiments, case studies, annotated results, annotated photographs of them performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose something that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the competence requirements in mind when they are selecting their evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirements for this subsection. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those requirements in mind when selecting questions and guiding the candidate. Bye for now.